Hello everyone, welcome to our channel. I am Tuxikert.
Hello everyone, I am the Dr. Wins. Welcome to our channel.
This week's video topic is tooth decay, and I'm going to direct my questions to Dr. Kazandı right away. First of all, what is tooth decay?
Tooth decay is the damage caused to our teeth by microorganisms that feed on food residues.
So what exactly are the symptoms of tooth decay?
The symptoms of tooth decay include sensitivity, especially when we eat something sweet, sensitivity to hot and cold, and visible discoloration on the teeth. They can be white or black. We can say that all the symptoms that bother us occur while eating or drinking something.
So how is the diagnosis made?
The diagnosis can also be made through observation. Sometimes we can't see it with the naked eye. I was going to ask that.
What is invisible tooth decay? Actually, we can answer both of them together.
Decay that we cannot see with the naked eye, especially the cavities, that occur at the junction of two teeth. However, they can be observed and identified through X-rays.
So what foods cause tooth decay?
Research has shown that sugary foods generally trigger tooth decay.
Since childhood, we've been warned on TV and by our parents, stay away from sugary foods so that our teeth don't decay. You're saying that sugary foods are the main cause?
Well, I interrupted you, but carbonated drinks also trigger tooth decay because carbonated drinks cause wear on the surface of the teeth. They create an environment where microorganisms can cause defects afterwards.
So what are the treatment methods and the precautions to take? What precautions can be taken to prevent it from falling out? And if it does fall out, what is the treatment method?
The treatment method is generally for tooth decay. They try to restore it with fluoride-containing pastes. If it's progressed to a point where we can't fix it anymore, we treat it with fillings.
If we can't treat it with fillings and if it's very advanced?
If it's very advanced, after that, the treatment methods continue in a sequence with root canal treatment and crowns, which we refer to as porcelain.
So are they going for an implant or a crown in case of tooth loss?
In cases of tooth loss, meaning as the tooth extraction progresses, these kids usually experience a lot of pain, so people tend to see a dentist during this time.
So how often, rather when, should one see a dentist?
Regular checkups with the dentist are definitely recommended.
How often should regular checkups be? Is it twice a year, for example?
The recommendation is to have a doctor checkup every 6 months, but of course, if you have a problem or discomfort during this time, you do not have to wait 6 months.
When we feel pain, it is useful to see a dentist immediately so that we do not come to the point of losing a tooth due to decay, right? Well, actually, I have another important question that I'm curious about. This is actually my last question. Does any disease in the body cause tooth decay?
Systemic diseases that have a significant impact on tooth decay are those that cause dryness in the mouth. Think of saliva as a natural washing solution in our mouth. All the factors that cause an increase or decrease in this are contributing factors to tooth decay. At the same time, stress can definitely lead to wear on the teeth, maybe even grinding, right? Especially at night, grinding your teeth due to stress can cause wear on the enamel, the protective layer of the teeth, making the surfaces more prone to decay. These are most obvious factors.
These are the factors, meaning the diseases in the body that cause tooth decay. These are the categories we refer to. You can evaluate it in this group. In this group. You can evaluate it in this group. In this group. So what do you recommend to our viewers taking care of their teeth at home to prevent decay? I mean, like a toothbrush, dental floss.
Especially for interproximal cavities. Shouldn't neglect using dental floss. The thing we neglect the most is using dental floss. As we mentioned earlier, interproximal cavities are not visible to the naked eye. However, can be detected with an X-ray. Don't neglect dental floss. Our mouth rinses that contain fluoride, for example. Of course, there are all sorts of products. Doctors will recommend this in the most suitable way for each individual. that hasn't been neglected. I'm not talking about that since everyone brushes their own teeth.
You're not mentioning it. Well, thank you. Is there anything else I want to add?
So, if there are things that don't come to our mind, if someone asks us, we would gladly answer those.
Yes. How do we answer? How do you ask your questions? You can send all your questions to Dr. Kazandı through our social media addresses below. Don't forget to subscribe to our channel, and thank you very much. You can send it to Kazandı. I say don't forget to subscribe to our channel, and thank you very much. Goodbye.
Hope to see you again.